am a professor of orofacial motricity at a university in Brazil, and my research has been turned to the validation of therapeutic intervention for surface electromyography. São Paulo is the reference seat in Brazil, and the university where I work is 96 kilometers away. Campinas is one of the most important cities in the interior of the states of São Paulo, by concentrating a very strong industrial and technology center that employs many people and trains many young technologists. This is the campus from my university, and the Unicamp was considered the first in Latin America in the international ranking. The university is a public university when the students don't have to pay. University hospital complex are located in Campinas and nearby cities, and they are part of the basic health system, in which the population doesn't have to pay, but serves the community in this hospital complex, clinics, and health centers is part of the curriculum. With this, we can identify the main complaints of the population, like children and the adults who cannot breathe through their nose. This difficulty can cause changes in the stomach pressure system, such as dental and skeletal deviation. One of the factors that can cause difficulty in breathing only through the nose is the action of certain muscles that make lip sealing difficult. It is also important to point out that the damage caused in the mouth breather is the same as in the oronasal breather. As we can see in the graph on the sides, there is a significant difference between nose and the mouth breather. For restoring nasal breathing, most students are focused on strengthening on the orbicularis oris musculature. But another important muscle to be considered is the mentalis. Mentalis muscles not propel a lip muscle, but on that controls the lips, as it helps to position the lower lip due to its slight vertical anatomic disposition, which favors the adequate position of the lower lip. Note the direct relationships of the mentalis muscles with the labialis musculature below. The incisor labis inferior muscles and fits in the lateral parts of the mental muscles, and the mentalis muscle has insertion in the alveolar mandibular eminence of the canine teeth and the lateral incisors and the slope of the central incisor. In the face of upper nasal obstruction, patients are forced to breathe through their mouths. In these cases, the mental musculature tries to seal the lips, but is unable to do so. As constant muscular activity occurs, the musculature then becomes shortened and hypertrophic. Look this record in electromyography in nasal breathing subjects, how the subjects have the sign low, and the oronasal breathing subjects have a hypertrophic musculature and hyperactive in musculature, orbicular and mental muscles. The hypertrophy of mental muscle makes the muscle more voluminous and shortened, making leaping ceiling difficult now. With that, our study sought to investigate the influence of mentalis muscle relation on oral nasal breathing. The study was approved by Research Ethics Committee, and the sample was comprised 19 participants, colleges, students, and employees of the institutions. And with 7 participants and experiment group with 12 participants. The inclusion criteria being over 18 years old, having a medical record and a report from the otorhinolaryngologist of the hospital, confirming they had been oronasal readers for more than 3 months, not having their upper areas obstructed. And the exclusion criteria being younger than 18 years, being a nasal breather, having a neurological impairment, take meal relaxant and or analgesic drugs, being in dental skeletal angle class 1, first division or class 3, having upper arc antagonics to lower lip with maxillomandibular overjet, having upper arcs overjet in the lip closure, having a face trauma, having a history of fibromyalgia, have a bread or hair in the perioral region. The message therapy. After the initial electromyography, the participants group experimental were shown how to do the message therapy, message techniques at the electromyography in laboratories of the institution of usage. This manipulation is done with the finger tips applying the muscle in intermittent compression and decompression, circular movement, skin and subcutaneous tissues over the underlying structures. The methods were performed by the participants until began to feel a slight discomfort in the musculature daily once a day for 3 months. It was possible to verify that there was a correlation between the orbicularis oris and the mentalis muscle, both and the rest and during swallowing. That is the relation of the mental muscle reflects in the lower part of the orbicularis oris muscles. And a significant difference in both the orbicularis muscles of the mouth and the mentalis in the experimental group have been proven, with decreased activity in both muscles. With this is possible to conclude the importance of mentalis muscle relation for lip sealing to occur. Okay, thank you very much.
Thank you, Dr. Mirian. That was a wonderful talk. Are there any questions for Dr. Mirian?